The mump is a contagious viral infection characterized by painful swelling of salivary glands, particularly parotid gland located below the and in front of the ear. The virus responsible for mump is transmitted through respiratory droplets or direct contact with infected person's saliva. Mumps is the most common viral disorder involving the salivary gland, mostly parotid, followed by submandibular, followed by sublingual gland, and rarely infect the minor salivary gland. And it is the most common cause of non-suppurative acute sialoadenitis. And parotid gland is almost exclusively involved, but submandibular sublingual gland may also be involved in this disease. Mumps virus is a negative sense single-stranded RNA virus consisting of a ribonucleocapsid core which is covered by lipid membrane derived from host cell, and it is prevented by MMR vaccine. The virus usually enters the host through the upper respiratory system, but the patient typically develops symptoms after 2 to 3 weeks because of incubation period. Most common symptoms are fever, malaise, myalgia, arthralgia, anorexia, headache may precede the parotid swelling, and there is prodrome period of these symptoms before the parotid swelling is seen. The parotitis is characterized by localized pain, tense non-petty edema of the gland, and usually associated with autalgia, trismus, and even sometimes dysphagia. The overlying skin may appear blanched and lack erythema and sometimes may be red in warmth. Symptoms, especially pain, are worsened by eating and chewing. Usually, the parotid gland on one side will swell first, followed by contralateral side. So, initially it is unilateral, then it is bilateral disease. A large majority of cases occur in children younger than 15 years of age. It's common in children 4 to 6 years of age, and it is equal between male and female. And diagnosis mainly by positive viral serology, and serum antibody level can be checked. The serum antibody levels peak around 1 to 2 weeks and are cleared by 9 months. So antibody is exist up to 9 months. Mumps can also be diagnosed by isolating the paramyxovirus from a buccal mucosal swab or urine sample. And although this is not required because it is mostly clinical diagnosis, in CBC you can see there is leukopenia and serum salivary amylase is elevated in this mumps infection. So this mumps is common during the spring season. The laboratory diagnosis of mumps first is viral isolation test. This method involves collecting a sample of saliva, throat swab, urine or CSF, and there is virus growth in the medium. This process is long process. It takes about 15 days. Second test is PCR test, polymerase chain reaction test. PCR test detects the genetic material, mainly RNA of the mump virus, and it is very sensitive and rapid method of identifying the virus. Third test is serological test. Blood test can detect the presence of mumps specific antibody, IgM and IgG. IgM antibodies usually indicate a recent or current infection, while the IgG antibodies suggest past infection or post vaccination viral IgG antibodies. Fourth test is mumps specific Ig antibody testing. This test used to detect Ig antibodies which can also indicate a recent mumps infection. Mumps typically present with mild viral infection can lead to several complications, especially in adolescent and adult. Some of potential complications include: first common complication is orchitis, inflammation of testes in male, which can lead to pain, swelling, and rarely infertility. Second complication is euphoritis, inflammation of the ovaries in female, which can cause abdominal pain, fever, and rare cases infertility. Third complication is meningitis, swelling of membrane around the brain and spinal cord, resulting symptom like headache, fever, stiff neck, and sensitivity to light means photophobia. Fourth complication is encephalitis, symptom of meningitis with neurological complication like drowsiness, seizure, and coma. Fifth complication is pancreatitis, inflammation of pancreas causing abdominal pain, nausea, vomiting, and some complication with digestion. Sixth complication is deafness. It is SN loss which may be temporary or permanent. It may involve both or unilateral ear. And other rare complications include myocarditis, which may lead to myocardial infarction, may lead to cardiac arrest. The prevention of this by MMR vaccine means measles, mumps, and rubella. It is most effective vaccine available for this mumps viral infection to prevent it. The treatment of mumps mainly focus for supportive treatment and only symptomatic treatment like rest, hydration, pain management by mainly paracetamol, and soft diet. Sometimes required warm and cool compression, and you require isolation of that particular patient to prevent further infection. And this is viral infection, so antibiotics are not effective against any viral infection in this. If this viral infection persists more than 7 days and there is secondary bacterial infection, then you can add antibiotics. For this viral infection, there is no specific antiviral therapy available for mumps.